Hello everyone, a warm welcome to everyone. Good evening. We are very sorry for the delay. So let me introduce myself. Good evening everyone. My name is Nikhil Manikanta Bachu. I am from Medworld Expo. So Medworld Expo is a unified global healthcare platform where you can connect manufacturers, distributors, clinics, labs and all the healthcare platforms in one single place. So before we start the session, I just wanted to give a quick introduction about Udaysri ma'am. So let us give a warm welcome to Udaysri ma'am, an accomplished medical professional dedicated to the field of pulmonary medicine. Dr. Udaysri completed her MBBS from PES Medical College, where she herself, through strong academic performance and a passion for teaching. She has previously served as a tutor in the Department of Microbiology and Forensic Medicine, gaining the valuable experience in the clinical educational and the foundational medical sciences. At present, currently Dr. Udaysri is pursuing her MD in pulmonology at Kurnool Medical College, where she continues to expand her expertise in the respiratory health, clinical care, and research. So her commitment to understanding the and improving the lung health makes her an ideal speaker for today's webinar. So today's webinar topic is how pollution and smoking affect lungs health and nutrition in lung disease. So we are honored to have us today. So please join me in welcoming Dr. Udaysri Chintala. Over to you, ma'am. Thank you so much.
Thanks for the warm welcome. And let me present the document I have been preparing for today. Yeah. So, so today I'm going to speak about how pollution and smoking affects the lung health and the nutrition in lung diseases. So we are in a world which is uh, at most polluted, and our air quality indexes in cities like Delhi are falling down day by day. So let me start the effect of tobacco or the smoking on our airways. How there will be structural changes in the airways is the large airways, that is the bronchi. Uh, in the Weber's lung model, there will be 23 generations, which starts from the trachea to the large airways, the bronchi. There will be goblet cell hyperplasia, which leads to increased mucus, and the mucus gland hypertrophy leads to increased Reed's index. And the squamous metaplasia, that is the cilia, we have the ciliated columnar epithelium on the surface, the surfaces lining the respiratory system. When we smoke for a longer duration, the cilia will be turned from the ciliated columnar epithelium. It will be metaplasia to the squamous epithelium. So, due to the loss of cilia, cilia are like this this like a see. Uh, I think there is like reason. Can you
One
hear me?
minute. Yeah, ma'am. 1 minute we are checking it.
Yeah.
Yeah, ma'am. It's all over now.
So this I can hear the reason.
In the laptop, we have to turn off the audio, ma'am.
Okay.
Yeah, it's perfect.
Okay. Now you can hear me now.
When are recording
So
about?
That's true. Audio is also.
so you can hear me now, right?
Yes, ma'am, can hear. It is clear.
Yeah. Uh, So, what happens to the large airways due to prolonged smoking is there will be goblet cell hyperplasia, leading to the increased mucus and the cilia, which helps in cilia, these hair-like projections which are present on the squamous epithelium. They help for like if we like get something like dust into our respiratory system, the cilia, which are in the 9+2 arrangement, move like this, and like they will throw all the dust or some foreign bodies or foreign particles, which are minute sized upwards. But due to the loss of cilia on prolonged smoking, there will be squamous metaplasia. That is, the ciliated columnar epithelium will turn into squamous epithelium, and the goblet cells, which produce mucus, will increase in size, leading to increased mucus. So the whole respiratory system will be filled with the mucus, and also it will not be able to throw out any infections. So infections which we get into our respiratory system. And this squamous cell metaplasia can lead to the squamous cell carcinoma too. And there will be this small airways, bronchioles. There will be fibrosis, that is thickening of the bronchioles, leading to fixed obstruction of the small airways. So we have now understood how there will be structural changes in airways on prolonged exposure to smoking. And the functional changes, or these are the volumes, lung volumes, which will be decreased due to smoking. There will be reduction of FP1, that is forced expiratory volume 1, and the decreased FP1 by FPC ratio. That is goal criteria for COPD. We all know the fourth respiratory volume in the first second by FPC, FPC, functional vital capacity, will be the standard for knowing whether the patient has COPD or not. And there will be air trapping. What happens is the alveoli will be emphysematous. They will become big, and the air will be trapped. And on the prolonged air trapping, it will lead to increased residual volume. That is, there will be air which we inspired stuck in our lungs, which we can't breathe out, and there will be increased functional residual capacity too. And there will be hyper responsiveness of the airway. There will be increased cholinergic tone and increased inflammatory mediators. So the smoking worsens asthma, induces steroid resistance, and these are all the functional changes. So we have seen how smoking affects the structure, how smoking leads to structural changes in airways, and what are the functional changes, the lung volumes that are affected by smoking. And let us see what will happen to the inflammation and the immune dysfunction due to smoking. So the inflammation is neutrophil dominant inflammation. We all know that neutrophil will be the first thing that will be present in any infection. So it will lead to the inflammation, neutrophil dominant inflammation, and the smoker's macrophages. So the neutrophil will lead to the phagocytosis, and the smoker's macrophages will absorb all the black pigment, and there will be decrease in natural killer cell activity, leading to increase in infections. There will be protease anti-protease imbalance, leading to the airway damage. This is what happens to the inflammation and the immune dysfunction. Okay, so wait a second. So, what are the carcinogenic effects of the smoking? There will be increased pH and nitrosamines, leading to DNA adducts and the P53 mutation. We all know this P53 is the thing which will be protecting us from not having any DNA damage, and the squamous metaplasia will turn into dysplasia on the long run, leading to carcinoma. The common cancers which can be caused due to smoking or squamous cell and small cell carcinoma. So the airway specific clinical conditions due to smoking or chronic bronchitis, where we will be seeing the productive cough, that is cough with sputum for greater than 3 months for 2 years, and the respiratory bronchiolitis and COPD, small airway disease, leading to the narrowing and fibrosis. I have just gave a summary in the structural changes due to smoking, how it can lead to the COPD, chronic obstructive pulmonary airway disease, and the asthma worsening due to steroid resistance and increased inflammation. All this all of these changes are due to smoking on the long run. And the mnemonic which we can remember for what are the effects of smoke on our airways, or SMOKE, squamous metaplasia, which can lead to increased infections, increased viral infections, and the mucus gland hyperplasia that leads to increased mucus deposition on the airway. You always see the smokers, they will be like telling us the compliance like, ma'am, I'm not able to afford the sputum, I'm not able to clear my airways. I'm like, because of the mucus gland hyperplasia, there will be more production of the sputum, and the airways will be clogged with the mucus production, and there will be obstruction, the small airway narrowing, which I have just mentioned. There will be small airway fibrosis and narrowing of the small airways. Skull cilia, that is, we have seen the ciliary epithelium turning into squamous meta epithelium, so there will be decreased cilia, which leads to decreased mucociliary clearance. And the mucociliary clearance is one of the important mechanisms through which the lung has its immunity. It will throw out all the foreign particles or infections or any viruses which we breathe through us to outside. There will be no cilia and emphysema. I have said now, alveoli will become the alveolar wall has some increased elastin, and decrease the things will lead to emphysema because of the protease excess. The protease anti-protease balance leads to emphysema. These are all the effects of smoking on the airways. So this is the picture of the lungs destroyed due to cigarette smoking. Lung cancer. Smoking is the so so these are all the effects of smoking, uh, which I have discussed. There will be increased lung cancer because of all the carcinogens emitted through smoking, and there will be emphysema as smoking destroy the air sacs because of the protease anti-protease imbalance. And there will be structural damage to the airways, and there will be chronic bronchitis because of the persistent inflammation. So these are all the harmful effects of the smoking. We will be seeing many patients coming to the OP with the prolonged smoking habit. They will be smoking for many years, and the smoking destroys the respiratory tract in the ways which they don't imagine. And we always know that the number of pack years has a significant impact. We calculate pack years with the number of we calculate pack years with the number of cigarettes. So if the patient has smoked one pack per a day with the number of years, like if the patient has smoked one pack per day per 10 years, it will be 10 pack years. And if the patient has smoked half pack per a year, half pack per day per 10 years, it will be five pack years. So the number of small pack years has a significant impact on developing COPD in this patient. So I'll be presenting in a minute. Yeah, you can see the screen.
Yes, ma'am. You can see your screen.
No, no, no. Like you can see the screen, but the problem is the audio and video are not enabled in my laptop account.
We
You
can
can just
hear you
start
and you
your
can see
video.
your screen both as well, ma'am.
Okay, 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 okay. You can hear me and see me both.
Yes, ma'am.
Okay. So let us go to the effects of the effects of the pollution on the lung health. So we all know that the air quality index is dropping too much in many of our cities, and the types of air pollutants which are present in our cities are PM 2.5, which deeply penetrates the airway, and the PM 10, which leads to airway irritation, the ozone, which leads leads to oxidative stress, and the nitric oxide and sulfur dioxide, which leads to airway hyperreactivity. The indoor smoke coming from the biomass fuel or incense. So the people who cook for long time, you can see in the restaurants, for presenting you with the cancers like adenocarcinoma and or small cell carcinoma, and the people who use a lot of incense sticks for praying and doing anything, this will lead to the cancer or irritation. It will lead to the worsening of the asthma or other airway diseases. These are the types of air pollutants which we see. The mechanism of the lung injury. Here also the mechanism starts with the neutrophilic inflammation and the reactive oxygen species leading to the epithelial barrier injury. The mucociliary dysfunction, which we have seen that happens in the smoking, also leads to the mucostasis, that is mucus clogging the airways, and the alveolar macrophage impairment is also seen. It will also lead to impaired lung growth in children. You might have been observing this or listening to this in the news that the children of the Delhi will be mostly will be mostly suffering from asthma in the future. Why do you think that's happening? Because of the pollution, there will be impaired lung growth in the children of places with low air quality index, particularly places like Delhi. And the clinical effects which we see in the people who are exposed to the pollution or cough, wheeze, and dyspnea, exacerbations of this asthma and COPD, and the reduced functional forced respiratory volume in first second over time, and there will be increased infection and the cancer risk. We have already seen the PM 2.5 being the carcinogen. The impact of the pollution in asthma is there will be increased airway hyperresponsiveness, and it enhances the IgE mediated sensitization, and there will be exacerbations of exacerbations of asthma due to the pollution. So increased pheno during exposure. These are all the effects of the pollution on already asthmatics. The impact of pollution on COPD. Pollution will also lead to chronic obstructive pulmonary diseases. We will mostly see the COPD in male patients, because in our country, for some reason, the smokers will be mostly males. For not some reason, it is usually seen that the smokers are mostly males in our country, but we may see COPD in females too. What is the reason for this thing? I have already said about the incense. Most of the females in our household, they use incense sticks, right? And then it will accelerate the FP1 decline. And the biomass smoke, that is the people who will be working in factories and the people who will be cooking, uh, as absorbing the fumes for a long time, all those people. And there will be increased frequency or severity of acute exacerbation of the COPD, and it also promotes chronic bronchitis phenotype. And so these are all the effects of pollution on the airway health. And let us go to the nutrition in lung diseases. So I would want to speak about the nutrition in lung diseases in detail more than the slides. I work in a government setup actually. And the people here, I see TB cases, like the 10 patients I see, the most of them will be the TB patients because of the low nutrition status, poor income. TB is so much common in the place which I work, that is the Cardinal, and there is the nutrition also impacts a lot on chronic diseases which present in to the respiratory medicine ward, that are chronic obstructive pulmonary disease. The importance of nutrition in respiratory. I'll be speaking about the importance of nutrition in respiratory health and the impact of the nutrition on immunity, muscle strength, and the other outcomes. So, the malnutrition in COPD. Malnutrition COPD. In COPD, there will be cachexia because of the increase in interleukin 1 and it leads to the people not able to eat food, and there will be decreased appetite in COPD. So, and also there will be increase in metabolism, there will be increase in work of breathing, because the patient can intake, and there will be like the person can inspire the air but cannot expire fully. So, there will be increased work of breathing, leading to increased energy expenditure, and there will be muscle wasting and decreased respiratory muscle strength. So the people with COPD need high protein, high calorie diet. The people should also observe that if the patient has obesity along with the COPD, there should be calorie restriction, because if the patient has obesity, there will be decreased lung volumes too. So the person should maintain high protein, low minimum calorie diet if the patient and is obese, and the high protein, high calorie diet is recommended in malnutrition in COPD. um, as we just spoke, the obesity and the lung function are related in a manner that if the person is obese, there will be reduced lung volumes, and it will the impact of the obesity on asthma and obstructive sleep apnea. So, in obese people, there will be hypertrophy of the muscles of the like tongue, and it may fall backward, leading to obstructive sleep apnea. So the weight reduction improves symptoms. So these people should definitely depend on high protein and low calorie diet for all these things. So I'm also going to speak about the factors such as uh, how can we obtain optimum nutrition in the lung diseases. So can you see me?
No, ma'am.
Oh, okay. Please enable my video so that you can see me.
Yeah, it's visible now, ma'am.
Okay, you can see me here from here, right?
Yes, ma'am.
So I'll give a quick summary of whatever I spoke, and I'll just speak about nutrition in pulmonary diseases, which will be optimum for everybody. The thing is, I always prescribe the patients or the people who come with malnutrition to at least eat two boiled eggs, which serve as a complete nutrition, has high net protein absorption, net protein utilization, and uh, is economical too, economical feasible. There will be no longer times of cooking. In people suffering from tuberculosis and COPD, the people don't have much energy to cook their meals. So I think boiling eggs is a simple process, and the people can have great amount of nutrition from the boiled eggs. If the patient is a vegetarian and he needs his protein, the protein is what that helps in building immunity, and also will be present in the architecture of the respiratory system. So the person should be able to have more protein in his diet. The other sources of protein in vegetarians or paneer, tofu, soya, yeast protein, and the most affordable options for the people from the low incomes or boiled chana or other things which the patient can consume, and the patient should also choose more fiber, because in COPD it will definitely have other metabolic functions affected along with the lung health. Like the people will have slow metabolism, leading to decreased digestion. There will be people presenting with not passing stools for a long time. I prescribe the patients to eat high fiber. The 10 to 15%, 10 to 15 grams of fiber can be taken per day. People can consume fiber rich foods like vegetables, like cut onion, and then bindi has lot of fiber. That is the lady's finger, okra or bindi. It has a lot of fiber, so the patient can consume vegetables like bindi, green leafy vegetables. Green leafy vegetables also produce optimum antioxidants. So the patient can have green leafy vegetable dal, which through which he can get protein plus the antioxidants from the green leafy vegetables and fiber in a single place, and cut vegetables along with each part of the diet. So the patient should be focusing on the high protein and the high fiber along with antioxidant rich diet. So however colorful our meal should be, the amount of nutrients will be the more. So patient can consume all the rich the vegetables that are rich in antioxidants such as capsicum, and then green leafy vegetables as I earlier said, and other anthocyanins and beta carotene rich beetroots, carrots, everything they can add to the diet. So the main emphasis in of the nutrition in the COPD patients can be high protein, high fiber, and then high in antioxidants. And the people who should be on the diet which the people should be avoiding is smoked fried food and the food that causes bloating, because the bloating can lead to reduction of the lung volume and in turn lead to a lot of problems for the people. So people should not consume the things that bloat them heavily and fried food, and they should also be uh, far from the spicy foods with high amount of mirchi or long peppers in them, because when the patient is consuming TB medication, and there will be gastritis, and the metabolic effects of the COPD will also lead to gastritis in the patient. So the patient should consume low amount of spice in the food, a low amount of oil, and low amount of salt. And this is all the emphasis of the nutrition in lung diseases. So thanks for giving me this opportunity to speak about how smoking affects the lung health and how pollution will be affecting our airways and the nutrition in the lung diseases. So I spoke about how smoking. Uh, yeah, thanks for this opportunity.
Thank you so much, ma'am. Ma'am, we have so many questions in chat box. Maybe we can close with the questions and I'll go with the conclusion, right?
Okay.
Yeah, we have a question from Pawan. What are the simple lifestyle changes people can make to improve their lung health?
The simple lifestyle changes that can help the people in improving the lung health, or the first thing is the patient can incorporate breathing exercises into his daily routine. There will be different set of breathing exercises for different ailments, and also the normal and perfectly healthy individual can practice pranayama. You all know about pranayama, right? That is the breathing technique which is used in Ayurveda, in yoga. The pranayama can definitely help in increasing the betterment of the lung volumes and increasing the lung health on a longer run. It will definitely be a help to the mucociliary clearance. And there are a different set of exercises for the COPD patients, and for the TB patients also. The post PTB there will be fibrosis and scarring on the lung surfaces. If they do regular breathing exercises, it will help for the mucociliary clearance, and on the long run the patient can survive better. And the second thing which I emphasized a lot is the nutrition in lung diseases. Having a high protein rich diet, that is including eggs and all the other protein sources I have listed above, and also high fiber diet with all the vegetables, and a diet that is low in spice, oil, and fried food. The diet does definitely impact the lung health. And exercising, and also something which I observe in this cooler climates is people running in the fog or cool climates in the morning, that they should avoid. Try to run when the climate is a bit sunny, because the people who are asthmatics, when they run in the fog, it will lead to exacerbations which we don't want, right? So that is one tip I want to give.
Thank you so much,
Yeah.
ma'am. We have another question from RB. How can we protect ourselves from air pollution in daily life?
So if you're traveling in a city which has extremely low air quality index, like the Delhi, because that is what we see on a daily basis, right? In such cases, you should be wearing a mask. Uh, I prefer using an N95 mask in such conditions, and also the thing which will be so diabolical, or something which you think is not possible, is you can plant more trees, and which will help in the long run. And also you can you can install purifiers if it is affordable for you. You can, there is this joke that is circulating on Instagram about gifting air purifier for your girlfriend in metro cities, but that's not a joke. It will definitely help them in the long run, and it will definitely help in de-aging the person too, or
Thank you.
anti-aging for the person.
Thank you so much, ma'am. We have a question from Sitara. Ma'am, how does nutrition affect people who already have lung diseases?
So nutrition is most important in the people who already have lung diseases. The most common disease which we see on a daily basis, I mean, which I see on a daily basis, is tuberculosis. The major basis or the pathophysiology of the tuberculosis is low malnutrition. Malnutrition leading to the low immunity, giving leading to the tuberculosis on the long run. So the TB patient should consume high protein and high calorie diet on a daily basis to recover. And the patient should not consume the things which have lot of spice in them. They will be consuming lot of medications on a daily basis. If we And it definitely leads to gastritis. And if he again consumes diet rich in mirchi or other spices, it will lead to gastritis. So he should avoid fried food and spice. And also the patients are already, they don't have appetite for eating anything, so but they should force themselves to eat in tuberculosis. In the COPD, I already emphasized it, that high protein diet with high fiber will help them in the long run to uh, sustain themselves. And also in asthmatics, they should avoid in the asthmatics, they should avoid the things which will lead to allergy. Asthma is the basic pathophysiology of the asthma is the allergy. So first, people coming to my clinic, they'll be saying if they ate the brinjal curry in the afternoon, it may have led them to increased SOB. I ate a lot of this meat in the afternoon, which lead to increased SOB. They will definitely know, like I ate curd rice, and after eating curd rice I have got an asthmatic attack. So this is all the cues which we get in allergy and asthma patients. They will be getting the cues, after having this food I'm getting the exacerbation or decreased breathing. So they should take the cues and just avoid, like they should maintain a small notebook or notepad of all the foods which led to the exacerbations and avoid them. So in simple, for the most of the lung diseases, high protein, high fiber, and high calorie in case of TB, and low calorie in obesity will definitely be helpful in the long run.
Thank you so much, ma'am. So that's all we have in the chat box. So before I close, I just wanted to introduce Medworld Expo for everyone. So how it can be benefited as a doctor for you, and we have most of the medical students and the practicing doctors in the session. So just wanted to give a quick brief intro, just for 2 minutes, of how Medworld Expo can benefit you.
Okay.
So I hope everybody can see my screen. So whenever you open www.medworldexpo.com, so this is how it opens. So as I told you in the beginning of the session, Medworld Expo is a global healthcare networking platform where we will connect manufacturers, distributors, and healthcare service providers, where in a sense like doctors, hospitals, laboratories, and everybody in one single place. So that is Medworld Expo. So if you can see at present, we have more than 7,000 plus manufacturers with us, 11,000 plus distributors, and 14,000 plus healthcare service providers. And if you can see, there is 2 lakhs plus products already exhibited in our platform at present. So let us talk in the perspective of as we have most of the healthcare professionals in the platform in the meeting now. So I'll be letting you I'll let you know how it can be benefited you in through Medworld Expo. So if you can see events, you can attend these kind of webinars through our platform. If I click on webinars, you'll be seeing different kind of webinars, and if you go little down, you can see other recorded webinars as well directly from the platform. And we have this CME programs which is upcoming soon. So we will be hosting different kind of CME programs. As ma'am, you're a doctor, you might be well aware about the CME credits. So these credits will be beneficial for most of the doctors to renew their licenses and different kind of things. So this kind of CME programs also we are going to start soon. So we'll be giving you notifications once we start this. And we have Knowledge Hub where you will be up to date with all the latest news and trends about the healthcare. We have Medwell blogs. So there are so plenty of doctors and the medical students and practicing doctors. They have written a number of blogs. So I request Udaysri ma'am, whenever you get free, just take it 2 minutes of time and you can write any quick blog about any topic. Maybe you can write about your today's topic as well. So you can find new doctors as well in the platform. So in this way, it will help you a lot. And we
Okay,
have medical
thank you.
communities. Thank you, ma'am. And we have medical communities. There are different kind of medical communities where you can create your own community or you can join different kind of communities. So if you're interested in cardiology, you can join cardiology. If you're interested to start a page for dental, you can start a page for dental. So these kind of communities we have in the option. Like this will help you to network since you are into the healthcare network. So the major thing you always have to look for is networking, right? So that is the reason we came up with this medical community option where you can network with n number of healthcare professionals directly through our platform. And we have journals you can browse, or if you're writing a paper or if you're writing any kind of articles, you can source different kind of medical journals or the healthcare journals through our platform. So this will help you to find the free journals which are listed in our platform. You can directly find those journals and you can use it for the citations or references purpose. And we have magazines in the same way how the journals goes. And career advancement program, for example, if any medical student or a practicing doctor is looking to go abroad and study, so the complete consulting process we will be helping throughout the journey, like how to start, which course you have to take, which country you have to go. So this kind of help we will be doing through Medwell Expo platform. And if you can see, these are the major premium features for all the medical professionals. And the other thing is jobs. If you can see, we have n number of job postings over here. So if you compare with the other third party companies job portal and our job portal is, so this is exclusive for all the healthcare company, all the healthcare professionals. So this will make your work more easy. Your profile will reach to the right person at right place. So it will make your profile shortlisted easily, and you will get n number of wide opportunities through our portal. So this will help for the employers and the employee as well. So if you're looking for a job, if you're looking to change, if you're any of your friend is looking for a job, so please suggest them Medworld Expo, and they can apply directly for any kind of labs, hospitals, diagnostics, any kind of healthcare organization through Medworld Expo. So that's all about Medworld Expo, ma'am. So thank you so much for your time today. We are very glad to host you today, and it was a really wonderful session. And thank you all the participants for being active from last 1 hour. Thank you so much, ma'am. Before I close, would you like to give any closing statement?
Yeah, I would love to give a closing statement. Can you hear me? Yeah. So thanks for giving an opportunity to speak about how smoking and pollution affects the lung health and how we can use nutrition to enhance the lung diseases. And I would always be open to guiding for any doubts in when people, young doctors would love to pursue pulmonology. And also, I definitely thankful for the great opportunity to meet with all the people I have met today, and thanking you. That's all.
Thank you so much, ma'am. Thank you, everyone. I hope everyone will have a good day. Thank you so much.